There are times when you may need some quick medical attention, but by the time you get in to see your doctor, the issue has passed. But that doesn't need to be the case. Watch this.
Thanks, Mary Lou. You know, everyone needs quality health care, but these days, the one thing many people worry about is can they even make a timely appointment with their doctor? Well, now convenient health care is as simple as walking into your local CVS pharmacy. We've all been there. You wake up Saturday morning with an earache or sore throat. What do? It's nice to have a clinic you can walk right in.
Mostly convenience. The location's right next to my house. I know that when I come here I can put my name in and get in right away. I've never waited more than 5 to 10 minutes to get seen.
Whether it's an illness like strep throat, or you need a flu vaccination, sports physical, or diabetes screening, MinuteClinic is the place to go for high-quality, convenient healthcare services.
We treat common illnesses, injuries, skin conditions, write prescriptions when clinically appropriate, and we also have a wide range of vaccinations and health screenings. Most insurance is accepted, but for those uninsured, we're less expensive than the ERs, urgent cares, and physician offices.
As a walk-in medical clinic staffed by nurse practitioners and physician assistants, MinuteClinic is helping to fill the primary care gap in the United States. With more Americans receiving health care insurance and fewer physicians to treat them, MinuteClinic fills a critical need: easily accessible health care, 7 days a week with no appointment necessary. It's health care with walk-in convenience right in the neighborhood for people like me with no time to wait. I'm ready. Back to you in the studio.
At MinuteClinic, patients are seen by physician assistants or nurse practitioners, just like my guest today, Meredith Dixon. Welcome.
Thank you. Thank you for having me.
Well, I'm really curious about this place because I took my niece there, and it was on a Sunday, and she went right through the whole system and everything. And I know you treat a lot of different treatments and services. So what exactly do you guys do there?
We can see you for a variety of things like strep throat, ear infections, sinus infections, people who suffer from seasonal allergies, any type of upper respiratory illness. We also see things like pink eye, women who think they have a bladder infection.
Oh.
We can evaluate sprains in your ankle or your knees.
It really seems like you guys have like a full service kind of thing, and a lot of people don't know about it. So how are you able to make it so inexpensive?
Well, first of all, we're a network with a lot of the major insurance plans. So if you have insurance, you can come to see us for what your typical primary care office visit copay is. So that's what you would pay at the time of visit. Or if you don't have insurance, we're a very affordable option. So people will find us about 40 to 80% less than if they were to go to an urgent care or an emergency room, which is the time that people tend to access us because we're open 7 days a week and we're there on the evening time and on the weekends. So
if you have a primary care physician, which of course you're saying you recommend, how do you interface with him?
that's something we really encourage. We want everyone to have a primary care provider, so we want them to have what we call as a medical home. So if you were to come to us and you didn't have a primary care provider in the community, say you were new to that community, we have a provider resource list, and we work with primary care physicians in the community and call them and make sure, are you taking new patients? Because we want people to be connected to a medical home.
Okay, what about cold and flu season? It's on us.
We're here. We need to get a flu shot. Very important to get those types of vaccines on board before we enter into flu season. So right now is a great time to get it. We need to be thinking about doing a lot of hand washing, making sure that we're not spreading germs.
All those things, especially kids. It's like sending them to school in a petri dish.
Absolutely.
Right. Well, thank you so much for coming. MinuteClinic is great. It really is. And I have firsthand experience. Thanks.
Thanks for trying it.